Mr. Chairman, I have an amendment at the desk.
The clerk will report, and there should be copies of the amendment.
Mr. Chairman, an amendment offered by Mr. McDermott, an amendment preventing the end of Medicare.
The gentleman is recognized for 9 minutes.
I'm offering an amendment, Mr. Chairman, to remove the Medicare voucher program from the Republican budget and retain the Medicare existing guaranteed benefit. This is the third time in a row. In fact, I sat on the Medicare Commission back in the 90s, and they tried it then, the voucher system. Republican budgets call for an end to Medicare as we know it with this Ryan voucher program. As in years past, my colleagues on the other side of the aisle are trying to hide what it's called. This time they're going to say premium support. So what's the difference between the voucher program from years past and this year's premium support? None. No amount of spin or new terms or rehearsed talking points can disguise this year's plan for what it is. If it looks like a duck and walks like a duck and quacks like a duck, it's a duck. Just like last time, the budget will ask 50 million seniors and persons with disability to trade their guaranteed benefits and reliable coverage of Medicare for a voucher, a coupon that's worth two-thirds of what today's standard plan costs. And seniors will be cut loose in the marketplace to try their hand at haggling with the insurance companies. Most of you don't remember your parents and the drug benefit, but I do. Many seniors won't be able to pay the thousands of dollars out of pocket. Once again, the Republican voucher program will dramatically increase premiums for these seniors, half of whom make $22,500 a year. That's less than $2,000 a month. Now, just like last time, this year's Republican budget will ask our vulnerable population to navigate a private system with no guaranteed set of benefits. They are not guaranteed anything, and they'll have little, if any, regulation and much higher expenses. Now, what could possibly go wrong with such a plan? Well, let me tell you. Over half the bankruptcies in this country are caused by medical bills. With this Republican voucher program, bankruptcies among the elderly will skyrocket. Why do we keep getting the same disastrous proposal for vouchering Medicare over and over? I can only guess that maybe some people don't remember why we created this guarantee in the first place. In 1940s and 50s and 60s, before Medicare, people had to get their health care as best they could through their kids or whatever, and doctors took chickens and bags of potatoes and whatever. We did this to make sure that old people got basic health care, to make sure the elderly in our society weren't bankrupted by their medical expenses. You can call the Republican program whatever you like, a voucher, premium support, comparative cost adjustment, but it just doesn't change what it is, the end of Medicare as we know it. You cannot change that fact. Either we remain society and guarantee for seniors health care, or we aren't. Either we take care of our people or we don't. We can have a balanced solution, or we can do what the budget does, tear up our social contract with our seniors and those with disabilities. This is a choice. It really shouldn't be a hard one. I urge you to vote yes on the amendment. And